Welcome to the New Chemist podcast. We're glad you're listening. Feel free to download this podcast on Google Podcasts, Apple Podcasts, Spotify, and a variety of other platforms. Here on the New Chemist, we discuss chemistry, which simply put is the science of change, as well as careers, community, research, and COVID-19. We're happy you're tuning in. My guest today is my colleague from Georgia Tech, Savni Kulkarni. It is so great to hear from you. Just briefly, I'll inform my audience about you. I met Savni at Georgia Tech, where she studied and obtained her bachelor's degree in biomedical engineering. Savni worked at Amniox Medical as a research and development project manager, coordinating clinical trials, creating protocols, and conducting several visits to different sites. She worked as a field clinical engineer at Abbott and currently serves as a MitraClip clinical sales specialist. Savni, thank you again for joining me. Please welcome Savni. Thank you so much for joining me today, Savni. It is good to have you on as a guest. I mean, it's been a while. It has been a while, but you still look well. Thank
you. Good to see you too.
Yeah. So as we begin, what have been your long-standing interest in the field of science?
So I think, my interest started back in around middle school. So I joined Science Olympiad mainly to build a robot. But then as, we started doing the hands-on, I guess the robotics team was full. So they moved me over to anatomy. And then as I started studying the anatomy portion for the Science Olympiad, the exams that you have to get to the final, I realized that, this was very interesting and I wanted to pursue a little bit more on the anatomy side. So I started studying more of that. And then in high school, I was part of this biotech class. So we did genetic modification of fruit flies, and that really piqued my interest. So I was working in a breast cancer lab for a little bit where we modified some breast cancer, the TKS5 protein. And then that led me to starting at Georgia Tech for biomedical engineering. So that robotics honestly initially piqued my interest in science.
Okay, that's good. Yeah, so I see. So tell me a little bit more about your high school project. You worked on fruit flies. What led you to work on that project? Was it given to you, or how did you choose that project? And how did because all of your story converges well to you ending up as a biomedical engineering major at Georgia Tech. So what about high school? Can you tell me a little bit more about that?
Yeah. So we had two options. You could either do this fruit fly, or it was, the Punnett Square project for genetics. So there was a paper version that you could do where, you cut up this circle with different enzymes and then match that, or you could do this genetics thing. So I decided that, I'd much rather work with fruit flies and figure out, look under the microscope, run labs on that, than this paper version where it's not as hands-on. So that led me to doing this fruit fly. And basically we were just mating. So it was like 8 days of growing this larva in a test tube, and they had different growth food mediums. And then at 8 to 10 days, the fruit flies would start hatching. So you had to extract females. So you'd use ether to knock them out, and then under a microscope, check all the fruit flies, separating male from female, and then leave the females for 3 days in a separate test tube. And then for every 3 females, put 1 male fruit fly in. And then they would mate. And then once their larvae were, laid again, we would transfer the larvae into a different test tube. Those would hatch, and then we'd, under a microscope, check their eyes. So it was to see the red eye versus white eye trait in the fruit flies. So, we did this for like 3 generations. I think everyone has done this at some point. And
Yeah. Drosophila melanogaster used a lot. Fruit flies are used a lot. Yep.
Yes.
So, how do you maintain a view of the bigger picture in your career and in your life in general? Like in this pandemic, a lot of people have been challenged. A lot of people have had to work from home. So perspectives and paradigms have had to change. So how do you maintain a view of the bigger picture?
So I think for me, it's a lot easier to maintain a view of the bigger picture by just setting small goals. So, every Sunday, I kind of sit down and list out, things I want to accomplish for the week, like smaller goals. And then, working towards achieving those smaller goals helps, get to the 1 or 2 bigger goals that I've set for the year. And so that's just the bigger picture that I have is, they're written down somewhere. But then every day, the smaller stepping stones are what I'm working towards. Especially during this pandemic, it's been important to it's so easy when you're working from home to have so many different tasks that you just don't feel like doing. So every day, setting like, this is the 3 things I want to do for each day of the week to help me accomplish my goals. That's been very helpful for me.
Yeah, that's good. So noting things down, writing it down, breaking it down into smaller pieces. I've read that a lot from a lot of different people because if you think about it, if you think of how big the task is, it may be overwhelming.
Yes.
It can be overwhelming.
Yeah.
But, like even when it comes to publications or even when it comes to experiments, like if you think about what's the end goal, that could be overwhelming. But if you think about it as to what do I need to do today? Or what do I need to do for this hour? Then you make it more specific. What do I need to do for this hour? Then I can proceed forward with the small goal. Yeah. It becomes more achievable and realistic.
Yeah, and I love lists too,
me too.
Listing things off.
Yeah. I think that must be a common trend for people who pass to Georgia Tech.
Yes.
So how have you been adaptive and creative in the field of science?
So I think
you work at Abbott, so tell me a little bit more about that.
Yeah, so I, at Georgia Tech, I did a couple of internships that were a little bit more clinical research focused. So one of them, I guess my main one, I was at a company that did amniotic membrane tissue. And I was on the clinical trial side. So I was writing protocols for retrospective studies all across the United States. And then basically going on doing site follow-up visits, making sure that all the data was being collected appropriately. And then later me and the team would get together and then analyze the data. And then eventually it would get published by the physicians that had, done the study. So that was interesting for me. So I picked, the parts of that job that I really enjoyed. And then when I was applying for jobs out of Georgia Tech, I was looking for something that would, loop in those interests from the clinical research internship that I had. So that led me into a field clinical engineering role with Abbott. So there was a team of initially 8 of us, and then it got expanded to 12, all put at different sites across the country. And we were collecting data on like cardiac catheterization labs. So there's, the stenting procedures that they do. We were collecting data on their workflow for the stents and analyzing that data, presenting it to them. And basically we wanted to establish a set workflow and just check how the data improves based on the physician's adherence to the workflow. So through that, I was, in a hospital every day, and there's so many cases going on in the cath lab that are outside of my scope. And what I tried to do was just, be open to other opportunities to learn. Yeah. So, the physicians I worked with are involved in research for multiple trials, and I would just ask them, hey, you have a case coming up this afternoon that seems pretty interesting. Can I join? So they would invite me in, and then I was able to learn a lot from them. They've been a very supportive team. So
that's good. I've heard it almost appears as if, or it seems as if, or another way you could put that is, I've heard people I was listening to a video from the Harvard Business Review, and they were talking about disrupting yourself, like jumping from one S curve to the next. And I can see how what you're doing is facilitating that, because as you open yourself up to new opportunities and you open yourself up to be like, I saw this interesting case. Can I listen? Can I follow? Can I learn? Yeah, you're learning more at the same time as you are doing your job that you're responsible for. That's good. That's a good approach.
Great because, you learn how much you don't know. And so then you can always, I would stand in the back of these cases just taking notes, and then I would go home and look up, oh, what did I see today? What did I not understand? Which is a lot. And then I learned more doing that. So
yeah, that's good. That's good. Yeah. It's important to be aware, or at least try to be aware of what you do not know. That's critical.
Yes.
Because no one knows everything.
Exactly.
And then 2, being humble enough to learn and keep learning. Yeah, that's good. So how have you sort of found the right environment for you to thrive scientifically and intellectually? So you are at a good school, Georgia Tech. Very good school. Yes. You are now currently working at a very good clinical company, or pharmaceutical clinical scientific company, Abbott. How did you find these right environments? How did you find them?
A lot of it was networking. So I was very fortunate in that, I was placed in a hospital in Phoenix for my first job where I was doing clinical research. And my entire team was incredibly supportive of, me wanting to learn more. And all the physicians that I worked with, they were very open to teaching. So I just asked questions about everything. And then through that, I actually was able to get into some of the cases for the current job that I have with MitraClip. So I asked, one of the physicians that I worked with for research if I could just come in on a Friday to, just observe some of his cases. And he was like, yeah, of course. I have med students too, so I'll be explaining a lot. And then I networked with the MitraClip team and then started going into more of their cases on days where I had time. And then, when I had some downtime, I would just research more about the procedure. And, there's a lot of waiting in between cases in the hospital. Like you have at least 30 minutes for turnover. So that was the prime time for me to just research some other, things that I don't understand. And that actually really helped me find this environment.
That's good. That's good. So networking was the key thing that helped you find the environment.
Yes, networking was definitely the key.
Yeah, that's good. So now other people can know that as well. So what would you say have been some of the most impactful and effective ideas that you've worked on to date on your project? What would have been the most effective ideas or effective strategies, or what complemented to your project working well? When it didn't work well, what did you do to fix it? What was effective? What was impactful?
So I think there's a couple of things that are pretty effective in my current role, and I think just in general too, when you're in college, moving on. And I think it's so easy to get, tunnel vision when every day you're doing the same thing, and it's very easy to just get stuck in that. And, sometimes you're going to have a more complex procedure or just a different anatomy of the heart. And then it's important to think outside of the box. So what I would do is just every idea that I have, even if it sounds a little too ridiculous or too crazy, I would write it down. And then,
Me too.
Every month, it's a great way to just, put it out there, right?
Mm-hmm.
And then if it doesn't make sense, it doesn't make sense, but at least you tried. And then sometimes the crazy ideas actually do end up working, and they work the best. So that's what I've been really trying to do, is just get creative with different things, like list 10 ideas. Some of them are going to be, straightforward, the ones that you do every day. And then the ones that are outside of the box, those are the ones where they get you actually thinking a little bit more creatively.
Mm-hmm. I completely agree. Being creative, failing forward, networking, those are important, very important.
And asking questions too, right? Like,
yes,
it's
I completely
so
agree.
important.
Yeah, because I'll be honest with you. When I take notes, I used to take notes in terms of writing facts and writing down vocabulary words, and that has its place.
Yes.
However, I've gotten to a point where I try to write down the questions.
Mm-hmm.
What are the questions that my professor is trying to elicit, or he's trying to get me to think about as he's teaching me in the class?
Yes.
Because this is how I see it. If I could get the right question, then the answer's a cinch.
Mm-hmm.
You just have to go to the resource, go to the reference, go to the material. So I'm noting down questions, and also that facilitates me when it comes to studying again, so I know how to make my flashcards quickly,
Right. Yeah. It's about the bigger picture always.
Yeah, the bigger picture. So how do you maintain a balanced life given all your responsibilities and accomplishments? Would you say you're balanced, or are you trying to achieve a sense of balance, or do you have a lot of priorities that you work through as you go throughout your day? How would you phrase it?
The list is most important for me, I think, for balance too. It's just, a list of things that, like, we keep a running list on our team. So, I have my own list of, this is things that I need to do. And then that helps me kind of plan my week out. So I'll, in a planner, kind of plan out like a lot time slots. And then obviously, the cases are first priority. So that gets listed. And then other time I have other, like checklist items that I need to accomplish for work. And then outside of that, I just try to, definitely take time for myself as well. Mm-hmm. So I try to work out about 4 or 5 times a week whenever I have time. Or, lately I've been going for walks at night, and that's been great.
Join the club. Join the club. I love my walks. I love my evening walks.
Yes.
Yeah.
The weather's nice.
Pardon me?
The weather's all nice at night,
I know, right? It's all quiet and stuff, and you can see
all the lights.
Yeah, I know, right? It's almost like one of the movie scenes and type.
Yes.
Anyway, yeah, man,
that's been really great. That's been really great for, just mental clarity a little bit. And then, I have that mindfulness app. So, like just a couple of minutes of like the meditation, that helps too.
Yeah, headspace.
Then actually my coworker got me onto that. He's been doing more meditating, so he's like, you should try this. It's good. So
yeah, I completely agree. I'm a person of faith, so meditation is important too. It's very important.
Yes.
Yeah. So how have you been so successful as a student in the field? Like, what helped you get to Georgia Tech? What helped you do well at Georgia Tech? How did you end up getting a good job? You mentioned networking, but what do you think has been a key factor in your success to date?
I think, it's always, having the desire to learn more. Like, I'm never content with what I know. Like, there's always something that I don't know. Like you said earlier, no one knows everything. So just always seek to learn more and take any opportunity that you can to learn and grow more. And then, even in Georgia Tech, like, there's so much that they threw at us every day that no idea. So, I think it's very important to, try to learn more, but also, like, ask for help when you need it. Like, you're gonna, like, put the ego aside. There's no ego. Like, sometimes it's okay to ask questions. Like, I don't understand this. And if, you're talking to people that have been in the field for so long that it's just commonplace for them. So obviously, like, they know this, they'll just, skim past it if you don't stop them to ask for help. So that's been, asking for help when I need it and just trying to learn more every time, like, every chance that I get.
Yeah, let the ego go, eh?
Yes.
Let the ego go. Yeah,
exactly.
I completely agree with you on that. And I would say having a desire to learn and understanding that it's okay to not know everything. I think those are very helpful to success. So how have you maintained vision and teamwork in your environment? You obviously work in a very collaborative space. So How do you keep sight of the big goals, the big questions, the important ideas, and how are you able to work well as a team member in your environment?
Yeah. So I think I've been very fortunate that, after leaving Georgia Tech, I've been a part of two really great teams. So my first job as the field clinical engineer, we had, we were a dispersed team. So, we weren't seeing each other all the time because we were all remote, like at, 12 different hospitals. But we still had, weekly calls to just go over objectives and goals, and just everyone presented, what had happened during the week and any breakthroughs that they had. And then we'd have monthly just idea sharings. So, someone tried something cool at the Cleveland Clinic, so they would share it with the rest of us. And then, we would go try that if we were having similar issues. And then in my current role now, I'm very lucky to have a team that's, we're very close and we work very well together. We're all based out in Phoenix together. So, we try to meet we meet more than like 3 times a week because we're covering cases together. But we'll start the week off by, just a brief 5-minute discussion. Like, this is what we have planned for the week. This is what we're trying to accomplish. And this is how it's going to help us for the month. We'll have monthly calls where we discuss, like, all right, this is our monthly goal for the quarter. And then that's how does that quarter, the goals overlay for the year. And then just, we'll have weekly just touch base meetings that, this is what we did that's working. This is what we did that's not working. This is where we need to improve as a team. And that's been really helpful for me.
Yeah, I completely agree. Because, I was listening to a talk on system dynamics from Professor MIT. And, they talked about the open loop model, in which you are constantly refining your input, constantly refining your progress. Yeah, so that's good.
Yes.
So why did you choose biomedical engineering as a field to major in?
So, like I mentioned earlier, when I was younger, I was interested in like the robotics, and then I became interested in anatomy. And, when I applied to Georgia Tech for biomedical engineering, I thought that's the best way to combine the two, like anatomy and robotics, biomedical engineering. There you go. Yeah. So I started because of that. And then as, as I progressed through the curriculum, like around sophomore year, I realized that, originally I was pre-med, and then I realized that was not the right career path for me. So I liked the engineering side a lot. So I realized that this is the best way to make an impact without having to go to med school, is to do biomedical engineering. There's so much innovation happening in our field that, you can make an impact every day in a different sector of the field. And that was very appealing to me.
That's good. That's very good. So do you have any advice to those wanting to pursue the field you're currently working in?
Yeah, I think my main advice. So I remember, sophomore year after BMed 2210 class, I'd come back from class and they told us that, to be successful in biomedical engineering, you need to get a master's degree and then maybe a PhD or become a doctor. And I'd called my parents that night and I was like, I don't want to do this. Like, maybe this isn't right for me. And, my parents just told me that, hey, like, are you interested in biomedical engineering? Is this something that you love? And I said, yeah, it is. So they said, don't let what other people tell you influence what you're doing with your life. Like, there'll be a way if you find a way. So I think that was a piece of advice that I would give to anyone that's trying to pursue, whatever they want to. If it's biomedical engineering, just don't listen to other people. If you're passionate about it, you'll find a way and you'll find whatever works for you.
Yeah, I completely agree. It's important to have the right, the right opinions, the right advice in your ear, especially when you're making critical career decisions. Very important. Yeah. You have to know what to listen to and what not to listen to.
Exactly, because there's a lot of things floating around that, you shouldn't listen to that.
Yeah, I completely agree. So what has been some of the most beneficial advice you have received? What you say was still replaying in your mind from parents or advisors, or what else has been beneficial to you, even from professors?
Yeah, so I've been very fortunate in the current team that I'm with right now. And, I've found two really great mentors, one being my boss and the other being my coworker. So they give me a lot of good advice, but two of the pieces that have really stuck is, my coworker tells me this frequently that, just be you. There's only one Savni out there. So just be that one Savni. Like, don't try to be anyone else. Just be yourself. And, that's key. And then my boss frequently tells me, like, to stay grounded, don't get too high, don't get too low, just stay in the middle at all times and just stay grounded.
Yeah, I completely agree. Even if your head is in the clouds, have your feet on the ground.
Exactly. Yes. Yeah. Never get too overconfident, but believe in yourself.
Yeah. See, for me, the thing is, my faith helps me process a lot of things. Having a faith perspective allows you to keep perspective on your circumstance.
Yes.
That's what I found in my personal life. Especially when you have some success or you have some failure, you're able to put it in the appropriate category or the appropriate light, so it doesn't make you too high or make you too low. But yeah,
especially now with COVID too.
Pardon me?
Especially now with COVID too, it's so important.
Right?
Keep that perspective.
Yeah, COVID has brought a lot of challenges, but the interesting thing, Savni, COVID has, I think, allowed us as a people, especially I speak for people I've interacted with in the Bahamas, they have allowed us to, show or develop a sense of resilience.
Yes. Yeah. Absolutely.
Yeah. And also creativity. A lot of creativity was spurred in this pandemic.
With this telehealth, telemedicine, all of that is creativity.
Yeah. It's just really, really interesting. But thank you so much, Savni, for joining me today. It was good to have you on as a guest.
Thank you so much.
Thanks for listening. We're glad you were able to tune into this podcast. Once again, this is The New Chemist, where we discuss chemistry, which simply put is the science of change, as well as the other sciences, careers, community, research, and COVID-19. Thanks again for listening. Note, the views on this podcast represent those of my guests and I. Thanks for listening. We're glad you were able to tune into this podcast. Once again, this is The New Chemist, where we discuss chemistry, which simply put is the science of change, as well as the other sciences, careers, community, research, and COVID-19. Thanks again for listening. Note, the views on this podcast represent those of my guests and I.